let's begin with new information about a potentially deadly infection that's trying to spread in the state.
New tonight at 10, THV11's Rebecca Brown hears from public health experts who find themselves for the first time in decades trying to contain cases of tuberculosis.
Tuberculosis is one of the oldest known diseases, and doctors have had the upper hand keeping it at bay for many years. But now it is once again affecting Arkansans, with risk going up for small children and the elderly.
We are really worried, especially in clusters.
Tuberculosis, a bacterial infection that affects your lungs and other parts of the body. It's on the rise here in Arkansas.
This is a big problem for a small state like us.
According to the Arkansas Department of Health, so far doctors have seen close to 110 cases, an alarming trend that Dr. Naveen Patil says he hasn't seen in 17 years.
It spreads basically from close contact. So if you or your loved one has it and they are not diagnosed, it can spread to people, your friends and family.
Symptoms of tuberculosis may include chest pain, fever, night sweats, fatigue, and unexplained weight loss. And Dr. Patil says so far they're only seeing these cases affect certain populations.
In the African American population, Hispanic population, the Pacific Islanders, the elderly population, the people who are immunocompromised, and children. So as of now, this year, almost 1/3 of our cases, almost 40 cases, are in children.
With the exception of children, many of those groups mentioned also suffered during COVID, and the pandemic holds clues to why TB is spreading now.
Since the COVID pandemic, a lot of people did not seek care, a lot of resources were diverted. So all the after effects of that we are seeing now, and compared to 2022, we almost have 40% increase in cases.
And if you have a cough or cold that may have been lingering around, Dr. Patil says it's best to go get checked.
As it progresses, it becomes worse. So anything beyond that, it's always best to get an X-ray, check things out and see if you had exposure and go from there.
Rebecca, thank you. Now, TB is usually curable with antibiotics, and there is a vaccine to prevent catching it.
But because the shot proved so successful at tamping down TB decades ago, we don't really use it anymore. Dr. Patil does advise getting the vaccine if you are worried about being exposed.